Yeah. Yeah. Okay. And where do I mute myself? Wow. जी अस्सलाम वालेकुम Ishmala, can you hear?
Yes, Happy, I can hear you.
Okay, so shall we start?
Just a minute.
Okay. Slides are not visible on my side. Are they visible now? Yes, now they are visible. Okay.
Okay, so Assalamu alaikum. Am I audible?
Yes, bro.
Assalamu alaikum, everyone. I am Kushmala Azam, a fourth year medical student in Rawalpindi Medical University. Currently, I am working as Senior Vice President OHEC, Organization of Health and Economic Collaboration, is a student based non profit organization that aims to bridge the gap between the medical and economical sectors of Pakistan. And today is the third session of OHEC Health Awareness Campaign. The topic of our today's session is mental health awareness, related to mental health awareness, that how to manage stress and what's the right time to seek help. We all know that at some phase of our life we go through the ups and downs, and every chapter of life contains good and bad in it, and strangely it has been those unnerving moments that give birth to excellency if we tackle them rightly. And for us, OHC is the outcome from such critical times and is heading its way to revive the dying spirits and commands. As you all know, our today's topic is related to stress management, and we have our worthy speaker, Dr. Nazish with us. So I'll like her to share her thoughts about the topic, and then we'll be proceeding towards the question answer sessions at the end. Over to you, Nazish.
Assalamu alaikum, everyone. And first of all, thank you so much for giving me this opportunity to speak about this very important topic. And can you see my presentation or not? I've started sharing it.
Appears visible.
Like, am I audible?
Yes, you are.
Okay, okay, okay. First of all, I should introduce myself. I am basically I'm Nazish Tasadduk, and now people call me Dr. Nazish Tasadduk. I am graduate of Rawalpindi Medical University, batch 43, and I did my graduation in 2020, and like round about at the end of 2020 and 2021 ke start mein because of the COVID and all of this stuff. And I'm currently doing my last rotation of house job in medicine, HFH. And yeah, you guys gave me opportunity to speak on this topic, and so let's start with this: how to manage stress and right time to seek help. First of all, I'll give you an overview about what this session is going to include. And to be very honest, guys, I had a very little time to prepare for this. So I just made this presentation in like 20 minutes to give you like a layout of what we will be talking about. But हम ज़्यादा इसके बारे में नहीं बताएंगे verbally, and I will just give you professional things written on the slide so that you will know that I am also a writer in the making, because making we are not, we are alhamdulillah now, but not as a psychiatrist. I will be so my personal experiences and how I coped up with the 5 years of medical life and life in general, and what I learned, and what I thought it would help you guys make your lives easy, you know, and making lives easy around you, of the other people, of your friends, family. So, first of all, the overview contains the things that I'm going to discuss roughly. First of all, why I chose this topic, then there will be definition of health, then what is stress, then differentiating between stress and mental illness. Is stress a different thing and mental illness a different thing, or are they the same thing? And then there are other things we'll be discussing, inshallah. So first of all, why I chose this topic. I'm going to ask again Kashmala, because I have never done this online session before. So can you guys hear me? Am I audible?
Yes, you are.
Yes, you are audible.
Okay. Okay, and I would like to say that throughout this session, I thought that हमें बिल्कुल end पे question and answer session तो रखना ही है, लेकिन during the presentation, if you have question जो कि बहुत आपको actively लग रहा है कि अभी आपने पूछना है, so please raise hands so that I can, you know, Kashmala will tell me who's asking the question regarding to the thing that I am talking at that moment, and I can answer to that at the moment, you know. So that everybody can be involved. Boring na ho jaye presentation, because it's not a presentation as such, it's an open discussion. So first of all, why I chose this topic, it's because I left the page blank. Kashmala texted me and she asked me that we have this series of sessions going on, and we would like you to speak about any topic, any health issue, and she gave me different topics, and she gave me awareness of cancer screening in Pakistan, and awareness of cancer treatment in Pakistan, which is very important topic, right? So she asked me about like, can you do this? And I said, yeah, I can, obviously, because I've always wanted to speak on a public platform, because I thought it might help you guys, but I thought that why not choosing a topic which is very close to my heart and which I have struggled with basically throughout my life. So that's why I chose this topic. हालांकि ये लोग पहले एक mental health का session सर अजीम राव के साथ कर चुके हैं. He is an amazing mentor to me. He's an amazing psychiatrist, and obviously उनका session मैंने भी सुना, and he talked like professional does, and उन्होंने सारी proper academic और bookish और सारी professionally जैसे psychiatrist करता है उस तरह से उन्होंने सारा explain किया, describe किया how to seek help and what are the coping strategies to be an high achiever and everything. So I thought, add another session to it from the perspective of medical student, from a perspective of a normal student or a person who has struggled from the mental illness or these things, you know. So that is the reason I chose this topic. And in my general life, I used to guide people, and people used to come to me in DMs and telling me what they were going through. And some of the times I was going through the depression phase, and I could not answer them. And sometimes I actively helped them, and I told them the ways they can help themselves, or I tried myself to help them. So this was the reason that I chose this topic. Next is okay. Give me a minute. So first of all, definition of health. First and foremost, we need to understand what health is, because हमारे जनरल देसी कल्चर में हेल्थ को क्या समझा जाता है, और हेल्थ की एक्चुअल डेफिनेशन क्या है, what are the domains included in the definition of health. So can you, any one of you tell me what you guys think of what health is? Like any one of you.
Health is basically physical, social, and mental well-being of the individual.
Okay. Yeah, you're right. So, health, basically, according to WHO definition of health, is a state of complete physical, mental, and social well-being, and not merely the absence of disease. Like, not merely the absence of disease, but the presence of all the well-beings: physical well-being, mental well-being, and social well-being. That आप physically fit हो, and आप mentally fit हो, and along with that आपके social background, social circle में you are doing good. So that that completes the definition of health. And इसमें से कोई एक भी चीज़ missing हो, it devastates um, uh, your everyday life basically. So we should understand the importance of all the three domains. Most of you are medical students, so you all know, and I think we should be the last people on earth to talk about health as only being a domain containing physical health, right? Mental health is like 50-50, और या यहाँ पे जैसे social well-being है तो 30-30-30% करके उसका equal करता है उसको 33%, 33% and 33%, total makes 100% of it. So first of all, we need to understand that, and we need to understand, जैसे मेरे पास बहुत से लोग हैं, मेरी बात होती है अक्सर लोगों से, एंड बहुत से लोग जो हैं वो कहते हैं कि फॉर इंस्टेंस मैं परसों मेडिकल ईआर में थी, एंड a patient came to me. Obviously, when we talk about it, we do not mention the name of the patient, and we share this for the benefit of other people. So, a patient came to me. She was an educated lady, and she was having a panic attack. Panic attack that is a symptom of generalized anxiety disorder. She came to us, and breathing, and बिल्कुल उसी तरह जिस है और उसकी जो है स्टेट होती है, gasping state तो नहीं उसे कहते, obviously gasping the right term to use of it, but shortness of breath, where she was putting her hand on her neck, and she was saying that something is stuck here. And we checked her vitals. Her BP was okay, her saturation was 98%, oxygen saturation, and her pulse was through the roof. And for her satisfaction, for her parents' satisfaction, we gave her like the basic protocol of what we give in medical ER. We checked her vitals, we calmed her down, we attached oxygen for a bit, we nebulized her, and we gave a steroid shot. And then I tried to talk to her that, from our point of view, for containing all the criterias, basically you are all right on the aspect of physical health. Like there is no physical illness that is bothering you, but I think that there is something in the back of your mind, there's something in your mind that is bothering you from some time, or maybe it is the first time that you are experiencing these symptoms. But I think you should seek some help. Like there are professionals, and ये चीज़ कितनी इम्पोर्टेंट है, फिजिकल मेंटल हेल्थ दोनों चीज़ें, ठीक है. So yeah, that is the definition of health, and I think इससे ज़्यादा emphasize इस चीज़ पे नहीं हो सकता. Next up is what is stress. So stress basically we face in everyday life, like when demand exceeds results, like when we are doing our maximum, when we are providing results, when we are giving the hard work, and then the demand is more than those results that we are already providing. So that is stress. That causes the mental anguish, that struggle, that we're not doing enough, and this is not right, and and at that point we need help. So that is like and then we'll be discussing further what is the difference between simple, like normal day stress, and how to cope with it, and how to differentiate between mental illness and normal day stress, normal daily life stress. And there is one thing more, that when you study psychology, there are different personality types, type A, B, C, D personalities, and on the basis of the personality types and traits of those people, they perceive stress in a different way. So you'll be studying it in psychiatry, and in your behavioral science subject, type A personality, B personality. So there are people with different personality types who perceive stress in like in different ways, जो कि बहुत nervous हो जाते हैं, stress prone होते हैं. And there are some personality types जो बहुत chill होते हैं, बहुत easy रहते हैं, और हर चीज़ को बहुत चल लेना और इस तरह. तो एक तो ये innate आपकी personality में चीज़ें होती हैं, and then there are things that you can do to cope up with the stress. Even being a certain type of personality where you perceive stress बहुत ज़्यादा level पे, you can do stuff, you can help yourself, you can help your colleagues or your people around you to मैनेज दैट स्ट्रेस. ये नहीं है कि अब ये लिखा हुआ है कि जी आपकी तो टाइप बी पर्सनालिटी है तो आपने तो स्ट्रेस ज़्यादा नहीं लेनी है, यू कैन नॉट डू एनीथिंग अबाउट इट, इट्स नॉट लाइक दैट. बिकॉज आखिर में हम दुनिया में, वही मैं मिसाल देती हूँ कि फिर अगर करना होता सब कुछ अकेले करना होता तो अल्लाह ताला ने मुझे एक अलग प्लानट पर रखा. उसके लिए तो दुनिया बहुत अच्छी, तो कायनात बहुत बड़ी है ना, एक इंसान को एक अलग प्लानट पर रखा जा सकता था. तो उसने हमें साथ रखा, तो साथ रखने का मकसद यही था कि और इंसान बनाए, अशरफुल मखलूक़ात, तो ह्यूमैनिटी जिसको हम कहते हैं. So we need to help each other in all of this, and we need to help each other in sorting out this mess that has been created, that gets created on daily basis. Yeah, this is the reason we all are together. We all are connected. So yeah. Okay. The next thing is in everyday life we like face different stresses around us. छोटे होते से बड़े होने तक पूरी लाइफ में through different phases of life different types of stressors होते हैं. ये मैंने एक जनरल गूगल से इमेज उठाया जिसमें मुझे ऑलमोस्ट तो नहीं सारी इसमें इंटरफेयर कर रहा हो, दैट इज नॉट गुड. ठीक है. सो दिस इज haphazard, I'm sorry about it, but the thing is that there are stressors, and for that during like going through these stressors and these all of these things, all the mess that life creates, there are key points how to go about it. First of all, I mentioned that there are professionals who help you get through this thing. There are guidelines, there are guidebooks, there are motivational speakers, there are professional psychologists, psychiatrists who generally help you um, to cope with the life stressors, the general stresses that you like क्या कहते हैं उसे जो आपकी लाइफ में आते हैं, and not basically stressors, the anything that disturbs your peace of mind. सो फॉर दैट मैं इस पूरे उसमें ना उस चीज़ को कम्प्लीटली एक क्या कहते हैं ना कुएं में बंद करके उसको दरिया को तो रखना पॉसिबल नहीं था। इसलिए मैंने सर का पहले सेशन सुना एंड दैट वाज अ वेरी गुड कंपाइलेशन ऑफ एवरीथिंग दैट यू नीड टू नो in generally being a high achiever, and in generally being in generally spending a life that is more fulfilling, that is more happy, that is more stress free. Or and for that you need to adopt a good like healthy lifestyle, and for that you need to go for anger management that comes with the different stresses in your life, and the stress management strategies, there are various of them, and we are educated people, we can learn from those anger management anger management there are various workshops, various uh, various platforms that can help us, to help us go through that phase. Second thing is adopting a healthy lifestyle. Or I think now is the time that I should be telling you guys where I found out that uh, when I was facing stress in my life, and when I differentiated it from mental illness, like is this now turning into something that is more serious, and or is this everyday stress? So बचपन से there were many things in my family background, in my studies, in my social background that were causing me stress, and I was in general type क्या कहते हैं type of a person जिसको stress basically जो कि बहुत जल्दी I got anxious and I got everything got on my nerves and everything like that. So I motivational speakers and everything like that, because basically there was no one no specific person or no specific platform for me to help me get out of that rut, or get out of that difficult phase that was caused in my life due to various aspects. So what I'm trying to say here, because this all is getting to be jumbled up in your on your screens as well, and on your in your minds as well, and I want to keep this simple. So the thing is, and the point of me doing this presentation and this topic and this workshop is to help you guys understand the importance of mental health, and the importance of coping with the everyday life stress इस तरह से कि it does not turn into a mental illness. इस तरह से इन चीज़ों को डील करना, इस तरह से इन चीज़ों को फेस करना कि एंड पे जो है ये किसी आपको किसी बड़े डिज़ास्टर में ना फंसा दे कि आप उस चीज़ के विशियस साइकिल में इतना फंस जाओ कि आप जो है वो मेंटल इलनेस का शिकार हो जाओ एंड पे जाके. सो what is the time to seek help? Generally, when you face stress in your life, in your academic career, in your uh, in your everyday life with your family and all, first thing is to communicate. First thing is to communicate. Don't ever just sit in the corner, sit in your room, and just think that I'm not worthy of anything good. I'm not worthy of people understanding me, or I'm not worthy of anything good in life. And I am always doing my best, but I'm not getting anything in result. So don't ever think like that. Don't ever just keep quiet, just communicate, just speak up. Be it a family member, be it a colleague, be it a friend that is bothering you, or be it a situation that is creating problem for you and you are not able to understand what is happening. First thing is to communicate. Communication is the key to, I might say, communication is the key to save lives. Like, your words can save lives, and other people's words, when you are in a terrible state, can save your life. Because, to be very honest, guys, words of a very kind people saved my life, in fact. So, this was the main reason that I wanted to do this and I wanted to talk about it. And yeah. So communication is the key. You communicate first. You communicate to your closest people, your friends, family, your teachers. In fact, there are some professors or teachers जो कि हमें लगता है कि बात सुनेंगे, you know, there are people जो कि बात सुनेंगे. So just talk to them. Just tell them that this is happening in my life. Because I did that. I kept quiet, and I. There was a time in my life when I was in second year, like FSC, and after FSC, I was sitting in my university on a bench, and a tear rolled down my cheek. And I was using my phone, and I was all okay, and I was like, "What is this? Is it raining or something?" So I said, okay, no. And after that, I started crying because without any reason. So at that time, I thought that, you know, this might be something serious, because before that, FSC ke time se pehle, I was generally a sad kid. I was a kid who people used to scare easily, who people used to bully easily, body shame easily, and I was a kid to cry easily, and I never shared it with anyone. I was a quiet kid, and I used to, you know, sit down and just think about the stuff, bad stuff happening to me, and cry about it. So the time when to seek help, uh, you have to identify the danger signs. First, you have to communicate, and obviously, when you communicate, people around you will guide, like they will guide when you speak up. And I have like this, I've realized this in my life throughout these like last 6 to 7 years of my struggle with mental health, and that people do help. When you speak up, people can relate, and people usually there are different kinds of people. Some of them start sharing their experiences, their yeah, bad experiences, their stories of depression and everything, and they kind of nullify what you are trying to say, and you're like, यार मैंने क्यों बताया, क्यों बात ही क्यों कर दी इस बंदे से, ठीक है. So first of all, just try to identify कि यार किससे बात करूँ तो अगला बंदा सुनेगा, और फिर सुनेगा विथ नॉन जजमेंटल, एक बंदा जो सुने, ठीक है. So help can be found in your circle, in your friends, in your family, in your colleagues. So help can be found, ठीक है. लेकिन there are some phases when you need professional help, and that is the phase when you first need to identify the signs जिसमें आपको लगे कि, you know, now this is not something that the normal people can handle the situation, or I can handle the situation, you know. There are some danger signs that you need to look out for, and then you need to seek professional help. And the day when that I shared that I started crying and without any reason, and then I thought that this might be something serious and I need to go to a, you know, a doctor. But even then, I went to a medical specialist. I didn't go to a psychiatrist because I couldn't find a psychiatrist in my city who I could talk to. So I went to him, and he realized in the first instance that it is depression. So he started me on antidepressants, on low doses antidepressants. I took it for like 6 months, and then I quit taking medications, and I was like, I'm fine, I'm okay, and everything was like fine. And this was the time when I got admission in Sargoda University and BS chemistry, because मेरा पहली दफ़ा MCAT clear नहीं हुआ था, तो मैं सरगोदा यूनिवर्सिटी में, फिर जब मैंने दूसरी दफ़ा MCAT दिया and I got into Rawalpindi Medical University, I came here. First 2 years of my MBBS journey were very difficult. I had no friends, and I was generally friend of everyone, but I had no best friend. So उस वक्त जो है I had very difficult time of uh, क्या कहते हैं कि बहुत मुश्किल से उस टाइम को गुजारा, 2 साल वसारा, और कोई कोई क्वाइट रहने वाला, और वही उस चीज़ को फिर से मैंने किया और ना किसी से शेयर किया एनीथिंग। तो इन उस वक्त में, और जैसे रोल ऑफ सोसाइटी एंड अंडरस्टैंडिंग दिस इम्पॉर्टेंट एस्पेक्ट ऑफ हेल्थ, एंड दैट वाज वेरी इंपॉर्टेंट। माय फैमिली अंडरस्टूड मी फॉर मोस्ट, लाइक नॉट माय फ्रेंड्स, नॉट माय कलीग्स, बिकॉज मेरे कोई स्पेसिफिक बेस्ट फ्रेंड्स नहीं थे उस वक्त। So my family helped me through that phase of first 2 years of MBBS. I was living away from family in hostel, so there were many stressors and all of that. So in third year of MBBS, when I and this is very important thing that I want to share with you guys. In third year of MBBS, I started going into that. पहले तो ये था कि stress और stressful situations और उन हालात को जो है ना, I was managing somehow. I was going about my life, I was going about my exams and prof, और वो सारा कुछ चल रहा था और चीज़ें हो रही थी, and I started exercising, I started adopting healthy lifestyle. That helped me, but what I did not understand was that there was something bugging me in the back of my mind that needed professional help. So in third year of MBBS, there was some health issues that I faced, that were chronic, and that caused me depression, and that caused me to think and to take it seriously, and to go to a psychiatrist to seek help in a proper professional way. And let me tell you guys that it was life changing. Not at the start, not at the start of my treatment, or because उस वक्त तो मेरा कोई diagnosis नहीं बन रहा था ना, because the doctors were not able to understand what is going on, क्योंकि ये बहुत पुराना एक deep rooted problem चला आ रहा था. So the thing is कि there is a role of society in understanding what is going on with you, and your family should be supportive. But हमारे general desi culture में, हमारे पाकिस्तानी culture में, there are people, there are students who come up to me or who come up to my friends and say कि आपकी I'm just facing this thing. They typically explain the symptoms of depression and anxiety, generalized anxiety, and they say that my family is not supportive, my family is not supporting me financially to go about, to seek help professionally. And यार मैंने उन्हें बता दिया तो क्या होगा, they will think कि मैं पागल हूँ या मैं ऐसा हूँ या मैं वैसा हूँ. So this is very normal. First of all, you guys need to understand that this is very normal in Pakistan especially, and in all over the world, कि नहीं अंडरस्टैंड करेंगे, सोसाइटी अंडरस्टैंड नहीं करती है. तो फॉर दैट you are the person who needs to know your worth. That's the very first and foremost thing. That keep aside the family, friends, and colleagues thing that comes with the society. You are yourself responsible for understanding what your mental and physical health needs. And you need to understand that how important it is to work on both the dimensions, physical health and mental health, and the social background that is going about. So this is the first thing that you need to understand, that how able to get out of bed to go to college. You are not able to take bath. You are not for days, for like weeks, 1 or 2 weeks. You're not able to wash dishes. You're not able to. You're not able to have interest in anything good that you previously had interest in. So these are the signs that you need help. That And why you need help? Because these things are treatable. या तो होता है ना कि एक ऐसी चीज, एक ऐसी बीमारी लाहक होगी भाई जिसका कोई इलाज ही नहीं है ना, तो यार अब तो भाई मुझे डिप्रेशन हो गया है और अब तो दुनिया मुझे जो है ना कास्ट आउट कर देगी और अब तो काम खत्म. तो इट्स नॉट लाइक दैट. There was a point when I thought about it like that. There was a time when I started having suicidal thoughts, and I was like कि नहीं नाजिश यार, मतलब I do not want to think about it. I do not want to end my life. But the amazing thing is that it makes you think, it makes you believe that your life is purposeless. You should end it. And basically, I have it's a confession, or I don't know, but I proudly say that I am a fighter of bipolar type 2 disease. And I was diagnosed with bipolar type 2 in third year. That I do not want to kill myself, but my mind thinks that I should end my life. So just help me. And they completely ignored me, and they said that we are taking some sort of exam, and we will talk to you after that. So I kept sitting in front of their office for like an hour, crying, and then I came back. Yeah, so I went to another psychiatrist after like few days, and then after few days I went to another psychiatrist. And during this journey, I met some amazing people, and who literally helped me, who diagnosed me well. I met very good psychiatrists, a very good psychologist who literally changed my life and my view of looking at how I was looking at my life and how I was perceiving my bipolar. So where to find help is the platforms where you can literally find help, because we are here to help each other, right? So first we need to understand the danger signs, like कहाँ पे हमें जो है वो बात कर लेनी चाहिए किसी से. Because first and foremost, your family is important. Your parents need you, your siblings need you. बाकी फ्रेंड्स आते जाते रहते हैं, डिफरेंट फेजेस में डिफरेंट फ्रेंड्स बनते रहते हैं. आपके एमबीबीएस में और फ्रेंड्स होंगे, आज जॉब में और रोटेशंस लगेंगी और फ्रेंड्स होंगे. लाइफ के डिफरेंट फेजेस में फ्रेंड्स आपके चेंज होते रहते हैं, और जो अच्छे फ्रेंड्स होते हैं वो रहते हैं थ्रू आउट द लाइफ. बट द थिंग दैट इज कांस्टेंट इज योर फैमिली, योर parents and your siblings. The thing that made me stick to my treatment and to my journey with making myself better and come out of this was thinking about my parents, thinking about how far I have come and how far I have to go. So yeah, I have struggled a lot, and I do not want you guys to like struggle in any way, in any possible form. So this was the thing that I found online, that you are important, deserving, loving, intelligent, worthy, and compassionate, inspiring, brave, true, strong, and able. And I will keep telling you until you realize it for yourself. So yeah, I will keep telling you. I will keep booking sessions, and I will keep conducting random sessions even on my Instagram or Facebook page, inshallah, because this was the start, and this was a random talk and this was a haphazard talk. But this was basically sharing my journey with you, and that how I realized when I needed help, and sharing with you where I am at now, right? So when I started in third year MBBS, I was a shattered person. I had a shattered personality. I had supplies in starting from third year till final year, I guess. And I passed all the subjects in third year. I had supply in final, fourth year, then final year. And my mental health was deteriorated, and like I was compliant with my treatment, but I met some amazing people along the journey, and I know people who are still like struggling, but they are seeking help, and I'm so proud of all of them. So yeah, I want to tell you that now I am at a much better place, alhamdulillah, just because I sought help. I am still on treatment, but I am still on psychotherapy, and I'm still a fighter, but I'm at a much better place. And when people ask me that how are you, then I tell them that never been better, never been better. So alhamdulillah, uh, I wanted to share this journey with you to help you guys realize how important it is to realize when you guys need to communicate, when you guys need to seek help, and we are here to help you. There are people who are here to help you, right? Like there are many different support groups that I found online. There are amazing psychologists, psychiatrists in Pakistan who are like very inclined to helping students, basically, you know, who are like not financially affording the treatments and the psychotherapy session. If you don't want to start treatment like taking pills, because some people are still afraid of that, and that is a long talk, and we'll talk about that. So you can go for psychotherapy, you can talk about stuff and get it right. You know, they can tell you coping strategies, they can tell you breathing exercises, they can tell you relaxing techniques, and that really do help you, because those techniques helped me get out of that shit. And alhamdulillah, it's been I'm not and all of you please say mashallah that I haven't I haven't been having any suicidal thoughts in like past 6 months to 1 year, and that is a progress that I wanted to share on this platform. So there are further different online platforms, and inshallah there are platforms in making that we will be making, inshallah. And at the end you can talk to us, of course, of people of OHEC, that I'm planning that there are some people in OHEC like Kashmal Azam, and we are planning to make a platform where we can link you to some psychologist or psychiatrists. That if it is difficult for you, when you realize that you are going through some symptoms of anxiety, panic attack, the symptoms that Sir Azim Rao explained, chest discomfort, and all of the symptoms, breathing difficulty, and impending doom, and the time when you think your life is ending. Those are the symptoms of anxiety and the symptoms of depression that I told you about. If you think that those are the symptoms you are facing, or any other or any other mental illness that you know about, because you can Google it, right? What is happening, and then you can tell us, and we can connect you to different psychologists or psychiatrists that you want, and inshallah we can talk about it. And this is going to be easy, this is not difficult, so don't make this difficult, and make things easy for your um, colleagues, friends, family as well, but first help yourself. So there is a lot in my mind, Abibi, and this was all jumbled up. I'm so sorry, guys. But Filhal tak, this is all what I have to say, and you can quickly ask questions or add questions, like anything that you want. Because as I spoke my heart out, you can ask anything. You can ask your heart out.
Okay, thank you so much, Api. We have got some questions. I'll be asking one by one. Someone asked, "What is the real OCD?" As nowadays, everyone take it very
Okay.
lightly, and it's normal to call any of their habit as OCD.
Yeah, yeah, OCD is okay. I do not have any like professional information on this, but I have friends of me that are going through OCD, and at first they also thought कि जी ये मतलब वो जैसे we are like fond of labeling anyone with OCD. OCD is the obsessive compulsive disorder. First, there is obsession and then there is compulsion. Obsession is when you think about something repeatedly. Like, obviously, you do not want to think about it, but your mind is making you think about something repeatedly. Like that curtain is not in the right place. That curtain is not in the right place, or I have not locked the door properly. That is obsession. Then there is compulsion, that you do the same task over and over and over and over again. Like you lock the door and then you go out of the corridor and then you come back and then you lock the door again. So obsession and compulsion, and there's a repeated pattern that you need to recognize. And then I think this is something to be taken very seriously, and you can seek help for it. And this is treatable within the span of like 6 months to 9 months.
Okay. Next, we have a question: how to get rid of social anxiety?
Okay, again, social anxiety is something that is social anxiety is something that is a real form of anxiety, and that for that you need a professional to treat it, and that is treatable. You cannot get rid of social anxiety on your own unless and until you meet a professional who tells you the coping mechanisms, and then you can, inshallah, get rid of it very soon by working on those coping strategies.
Okay, so someone asked, what can we do if there is no choice of living without toxic people? For example, some toxic relationship or toxic marriage. Then what can we do in that case?
Okay, that is an important question, by the way. So you need to understand. Eh, uh, First of all, you need to understand if you have a choice of moving away from those people, or if you do not have the choice. And having choice is possible in the way कि जब वो लोग आपके friends हों या आपके colleagues हों, so you can definitely move away from them. But if those are your siblings and your parents, देन इन इस्लाम भी जो हमें सिखाया गया है कि कता ताल्लुक़ की रिश्तेदारों से जो है उसका कितना ज़्यादा गुनाह है। तो इस चीज़ में जो है ऑब्वियसली मॉडर्न हमारी जो थिंकिंग आती है उसमें ये है कि यार नहीं, कट आउट द टॉक्सिक पीपल, कट आउट द टॉक्सिसिटी, बट देयर आर सिचुएशंस वेयर यू कैन नॉट कट आउट फ्रॉम देम, सो देयर इज़ द key to help yourself with communicating with those people, because that is the thing you can do in that situation, that communicate, talk to them about it, tell them your concerns and ask them that what is the reason that they are being this toxic, because I think communication is the key in the situations where you cannot just run away or go away, or you cannot cut them out of your life. You just communicate with them, maybe that can help.
Okay. Someone asked, how are anxiety and insomnia interlinked?
Anxiety and insomnia are linked in treated.
Okay. Someone said, why do we feel sad and lonely all the time, even if we are present in the company of our friends or family members?
Okay, that is an important question. And that is a very general question people ask. Okay, first of all, we need to understand that uh, feeling sad and feeling lonely is not something to be associated with the presence of a physical being, like आपके friends या family मौजूद हैं तो you should not feel lonely or sad. That is not something that should be linked. Because वही जो चीज़ मैंने पहले mention की है कि there is um, there are certain mental illnesses where you feel alone in the presence of people, where you feel hopeless, in the presence of all the positivity around you. People like लोग छिड़क रहे होते हैं आपके ऊपर positivity and you are like negative all the time. So that being said, like you are basically facing something in your mind, that is the game of your serotonin and dopamine hormones that need help basically. So it is not the problem कि लोग मौजूद हैं or it is your fault that you are feeling lonely. It's not your fault. It is something that needs to be addressed, that needs to be treated, that needs to be talked about.
Okay. Someone said how to cope with anger issues.
Are there any more questions?
Yes, we have one more question. Someone asked how to cope with anger issues.
Okay. Based on my personal experience, okay, first of all, this is a separate topic that we need to talk about. We can have a separate discussion on it, but for now, I need to tell you that anger issues we have, like based on my personal experience, when I had anger issues, I still have anger issues with my mental illness. I distract myself. I distract myself from the thing that is causing me anger, and या तो मैं अपने आप को distract करती हूँ, and that does not work for long, to be very honest. मतलब मैं उस चीज़ से अपने आप को ज़्यादातर distract नहीं कर पाती हूँ, लेकिन फिर ये है कि dealing with the issue causing the anger, addressing that issue. अगर कांस्टेंट एक चीज़ आपको एंगर कॉज कर रही है तो व्हाट इज़ द कॉज बिहाइंड इट, यू गो फॉर दैट. एंड थर्ड थिंग इज कि यू यूटिलाइज द नेगेटिव एनर्जी जो एंगर की वजह से आपके अंदर आ रही है. यू यूटिलाइज दिस इन द फॉर्म ऑफ एनी फिजिकल एक्टिविटी. You go for a run, and I made this into work, and that helped me. When I had like uncontrolled anger in the start of my illness, I used to go out for run, for a walk, or sometimes you smashing a pillow, like जिस तरह से gym में you just smash the punching pad. So there are different strategies that can help you, but the strategies should be healthy ones, जो कि लॉन्ग टर्म में आपको उस एंगर से को करने में हेल्प करें. शॉर्ट टर्म स्ट्रैटेजीज पे हमेशा रिलाई नहीं करना चाहिए.
Okay, that's all from the question answer session. Thank you so much, Api, for your time.
You're welcome. And thank you so much, in fact, for letting me speak on this platform. Thank you so much.
Inshallah, we'll be doing more sessions in the future. And
Inshallah.
okay, so thank you so much,
Inshallah.
everyone.
More
Take care.
organized ones, inshallah.
Yeah, inshallah. Okay, thank you. Allah Hafiz.
Thank you, everyone, for bearing with me. Allah Hafiz.
Allah Hafiz.
Allah Hafiz.